Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe. This is a concise, well-crafted summary and it highlights only the important keywords. Vestibular schwannomas. So vestibular schwannomas, it is nothing but it has an ice cream cone appearance. Next is the lesions are seen at the cerebellopontine angle. So cerebellopontine angle lesions. There is a bilateral vestibular schwannomas. So bilateral vestibular schwannomas. So they are nothing but the hallmark of the neurofibromatosis type 2. They are hallmark of neurofibromatosis type 2. Then comes the MISME. So MISME, what is MISME? MISME stands for the multiple inherited intracranial. So multiple inherited intracranial schwannomas, and there is also meningiomas, ependiomas. So in short, it is known as the MISME, that is MISME. There is also the optic nerve meningioma, nerve meningioma, and this is present in the NF2. Then comes optic nerve glioma, This is nothing but in the NF1. To learn and grow daily like this, please do subscribe.